2022, the World Health Organization has delivered around 150,000 tests for Mpox globally, of which over a quarter have gone to countries in the African continent. In the SADC region, DRC remains an area of concern, and the disease has spread to other countries as well.
From the IFRC side, we do stand with what is recommended under international health regulations, which is that there's no need to close borders when we are in disease outbreaks. Diseases don't recognize borders. People will continue to cross a border, whether it is a legal crossing or an illegal crossing. It doesn't stop a disease from spreading.
Following the outbreak of Mpox, the recent SADC summit in Zimbabwe expressed solidarity and support for member states affected by Mpox and directed the Secretariat to convene an urgent meeting. The bloc wants health ministers to assess the impact of the disease and facilitate coordinated regional response.
I would not recommend a general vaccination campaign for the general population or at-risk populations at this stage. It is also clear that the vaccines that are available globally are urgently needed in Africa, urgently needed in regions where the virus currently is spreading, and there is a severe shortage of vaccines. So the EU, HERA, and other organizations have promised to donate vaccines or to bring vaccines into the region. The company that is producing most of the vaccines as well.
We are tracking closely on the spread of Mpox in Central Africa. We are pleased to see international leadership in this area. This year, I will note the United States has provided more than 17 million beyond our regularly programmed health assistance to support Mpox preparedness and response efforts in Central and Eastern Africa. We've been collaborating with partners to build capacities to combat infectious diseases, including Mpox, but also HIV, tuberculosis, malaria, and Ebola.
Nordic, one of the few drug firms that currently has an Mpox vaccine available, indicated in mid-August it had informed the Africa Centers for Disease Control and Prevention that it can manufacture 10 million doses of the vaccine by the end of 2025. Khumalo, SABC News, Johannesburg.